Hi everyone. In this video, we are going to cover the bones that make up the pelvis. Just note that individually, this bone is a coxa. If we have more than one, which we do, they are coxae. And then if we have them arranged so that they are connected at what we refer to as the pubic symphysis in the front here, that would make the pelvis. All right, so that's what we are going to cover today. You can see that we have all of our terms here on the right-hand side, and I'm just gonna follow them in order as we start pointing things out. You'll notice that some of our terms have been pulled off to the side. That's because these are the bones that make up the coxa. And then we have two features here that are kind of the combination of those three. So to start off, our superior region is the ilium. The posterior rounded is the ischium. And then the pointed anterior is the pubis. So let's go ahead and cover what these different features are. We're going to start off with the ilium. So this, again, superior portion is the ilium. The flat section of that is our iliac blade. Let me get my pointer here. Okay, so here is our iliac blade. The top of that is going to be our iliac crest. That nice curve there. It's kind of where you put your hands if you put your hands up on your hips. The iliac blade and the iliac crest, well, the iliac crest is going to lead you to two, what we refer to as spines, these kind of points here. The one that's towards the front, and we know that this is towards the front because this is where our pubis is. Okay, it's also kind of closer to where the acetabulum is. We'll get to that later. This is our anterior superior iliac spine, short term ASIS. Okay. All of our iliac spines are going to be excellent directional terminology words. All right, so we're going to the front. We are at the anterior. It is the top, because there's another one down here, superior. It's on the ilium, iliac, and then it's a kind of like a rounded point. This is spine. Anterior, superior, iliac spine. Just below it, we have this, which is going to be our anterior inferior iliac spine, shortened to AIIS. You can say whichever one. Now, if we follow that crest from our anterior superior iliac spine, all the way over here, here is our posterior superior iliac spine, PSIS, and our posterior inferior iliac spine, PIIS. Okay. Another way to remember which is anterior versus posterior is, as you can see here on the posterior, it's quite rough, but if I flip over to the other side, it's really rough. Okay, so here's our posterior superior iliac spine. Here's our posterior inferior iliac spine. We know that this is posterior because this is going to attach to our sacrum to form the sacroiliac joint. And because your tailbone is on your posterior, we know that this is the posterior side of the coxa. Okay? All right, we've gone over the four spines. Last thing to cover with the ilium is this large notch that's been taken out. It's like a big old scoop. This is our greater sciatic notch. Okay, greater sciatic notch is also going to be towards the posterior. just another way to help you remember that these are your posterior spines, right? If you've heard of the sciatic nerve, runs down your leg, it is going to kind of pass through this notch. This is going to lead us, if we follow it, to our ischium. Okay, so this posterior inferior section of the coxa. And you'll see that there's a bump here. That's our ischial spine. And just under our ischial spine, here's a much slighter scoop taken out. So here's our greater sciatic notch. The sciatic notch is actually going to travel through, and here is our lesser sciatic notch. Kind of goes beside that spine there. So lesser sciatic notch. If we turn, you can see that there's a very rough surface here on the ischium. That's going to be our ischial tuberosity. And then it's been a while since we've had the term ramus. We talked about rami with the skull. It means branch. I kind of like to rearrange the letters and think of an arm. And so this is kind of like an arm branching off. This is our ischial ramus, but it only takes us about halfway across this bridge, because then we're on the pubis, the pubic bone, okay? So the pubis right here has two rami and then that central body. So the top branch or arm is our superior pubic ramus. It then leads us to this point here at the front, which is our pubic body. And then the bottom branch is our inferior pubic ramus. And again, that's only going to take us halfway through, because then it becomes the ischial ramus. Finally, we have two more features to cover. Your hip is a ball and socket joint, so the head of the femur fits into the socket that is the acetabulum, and this is formed by all of the ilium, ischium, and pubis working together. And then we also have this opening here, our obturator foramen. Okay. Couple other side notes I'd like to make about the pelvis and the coxa or coxae. So, and I'm sorry that my camera doesn't have enough height here. So if we have our coxae together to make the pelvis, if I turn this way, you can see that the pubic bodies and the inferior pubic ramus and ischial ramus form kind of an angle. This is one feature that is used for identification of male versus female. It's one of the few aspects of, what we call sexual dimorphism, where males and females differ in terms of their skeletal structure. If you are looking at the pelvis of a male, this angle below the pubic bodies, known as the subpubic angle, is going to be less than 90 degrees. Whereas for a female, and this is kind of tough because this would be a male's model, but if it were a female, that subpubic angle would be greater than 90 degrees, much wider. Another difference between the male and female pelvis, your iliac blades for a male are going to point, again, I apologize, this is not the greatest way to show this, are going to point in a more vertical manner, whereas a female's are going to be wider. That's going to accommodate the development of a child. And then the true pelvis, which is the opening, in a male is going to be more narrow. In a female, it's going to be wider, right? Because baby's head needs to be able to fit through for delivery. Okay? Be sure that when you are practicing with the models, you practice with both left and right. It is important that you're able to identify a left coxa versus a right. And so essentially, if you are looking at the pubic body, whichever side the acetabulum is, it's going to be the opposite. So for example, I'm looking at the pubic body, the acetabulum is on the right, so that means that this is a left, right? Because if I look at the back of it, so here's the pubic body. This is if we were like from, behind the individual, or, a posterior image. The acetabulum is now on the left, and so this is a left. Okay?